In this video, I'm going to talk about spinal immobilization and show you how you can do this for someone with a low level of responsiveness or who's unresponsive. Spinal immobilization is important because it encourages the person and others to reduce movement, which lowers the risk of spinal cord damage and paralysis. It also puts us in a good position to monitor the person's breathing and reassure them in a quiet voice. First, choose a spot and position behind the person where you'll be the most comfortable. Your comfort is a high priority for this skill because if you're uncomfortable, you're much more prone to movement and making things worse, especially when you're distracted. Talk to the person as you go through this. They might still be able to hear you or even just hear the tone of your voice. Lay flat on your stomach and with your elbows firmly on the ground underneath you, hold gently on either side of the person's head. Stay clear of their face and ears so it's comfortable for them and they can hear. You could also kneel on the ground with your elbows on your lap near your knees and lean forward onto them, holding carefully on either side of the person's head. Either way, keep your elbows anchored to minimize movement. Once you're in position, continue to hold spinal immobilization while watching the person's breathing. If you become uncomfortable, consider using a soft, stable object like a blanket or a backpack to provide support, or carefully hand off spinal immobilization to another person. If the person shows signs of regaining consciousness, it's very important to talk to them and encourage them to stay still. If a person's distressed by your spinal immobilization, it's best to let go. Position yourself where they can see you without moving and use your words to calm them down and reduce motion. It's generally not effective nor legal to physically restrain a person who's trying to move. It's safer to let them move.